Hey everyone. So in this week's video, what we're going to do is talk about two different hinging variations. One where the pelvis is blocked and one where the knee is blocked. And in both these different variations, the main focus is to get dynamic load into the hip extensors, but via the pelvis. We have gone through some strategies in previous videos where we are trying to keep the pelvis more so fixed in place with a hinge, and then we're actually moving via the femur. So we're still getting load into the glutes, the hip extensors via the femur, but of course you are going to get some load into the quads, into the plantar flexors, potentially there as well. Here we are seeing these as more of your more local biased hip extensor loading strategies, where we're actually getting a direct motion of the pelvis over top more of a fixed femur. So we have a door frame hinge here and a knee blocked hinge. So I'm going to talk through the, first I'll just give you a very general insight into the difference between these two. With the pelvis blocked hinge against the door frame here, or against any corner of a wall, what that allows you to do is to allow for the pelvis to remain stable and to get that rotation of the pelvis along with the spine over top of fixed femur. It also allows you to, again, pre-position the femur, the shin position, the foot position, but mainly where you're getting is a rotation of the pelvis. And so you're getting a forward rotation and a backward rotation where the trunk is coming along with the pelvis for the ride. With the knee blocked hinge, what this allows you to do is to couple that angular rotational motion of the pelvis with more of a translation, a forward and backward translation of the pelvis. Okay, it's easier to do that with this one here because we are fixing the knee. And so we're essentially fixing the shin in place. And then as we begin to posteriorly rotate the pelvis, we're able to drive that pelvis forward. That hip will begin to extend with the femur as well. And then as we drop back into more of forward rotation, the hip will flex via the femur as well. We're getting that lengthening and shortening. So essentially the door frame pelvic hinge here, I think is a bit more coordinatively or is less coordinatively demanding. It's an easier entry point for the client. You're going to get a bit more load into the spinal extensors as well. I do like to use this in clients where they've been very flexed at the lumbar spine for a long period of time. We're able to get some length through the abdominals, and we want to begin loading the spinal extensors in more of a shortened position along with the glutes, for example. Okay, but again, there's many reasons that you might use these hinging variations, but something is blocked and it makes it easier for the client to load the thing that you're intending to load. So let's take a look at this one first. So in general, when we're trying to hinge with more of a glute or hip extensor bias, we of course want the knee bend because the knee bend will reduce the demand on the hamstrings. Okay, we're not going to be constrained by the lengthening demand of the hamstrings here. So you want to bend here, knee bend here. We want a little bit of a forward shin angle. And then what we're doing is we are bringing this hip back into extension. And this femur will more or less stay at the beginning of the setup, it's more or less parallel with the trunk here. What that does here, compared to, for example, if I brought this foot forward, this makes it easier for me to rotate my pelvis forward over top of this left femur. Okay, and this gets into the concept of kinematic coupling, where we're looking at how one bony segment can influence the rotation of its neighboring segment. So if you imagine, again, this is just a bit of a side rant here, not a side rant, but just an insight into something a slight bit different. When that hip extends via the femur, what happens there is that femur will actually begin to rotate forward. Okay, and if you were to imagine that femur as a spoke on a bicycle wheel, you would imagine if that femur goes back, because when the hip extends, the knee goes behind the body, it would continue to rotate in this direction. And if you watch the cursor there, that is rotating forward. This is forward, this is back, it's rotating forward. Hip flexion via the femur would be a backward rotation. And so that forward rotation of the femur now helps assist the forward rotation of the pelvis. Okay, whereas if this knee, if I was in a very short stance position, for example, where this femur is more flexed, the hip is more flexed, for example, relative to the trunk, sometimes in a client that is struggling to already rotate the pelvis over top the femur, they may find that very challenging, because very often what you'll find is that when the hip flexes via the femur, it may pull the pelvis back into a posterior rotation, and they struggle to get that forward rotation over the top. So it's just a little bit of an insight there into what you can do with the uninvolved side to help assist the rotation of the pelvis over top that target side. And so we're keeping the pelvis fixed in place here. And then what we're doing is I like to initially have the client place their hands on their pelvis. We can get a bit of rotation of the pelvis towards that left side if we wanted to here. And we are just keeping the spine more or less neutral or fixed in place, and we're rotating via the pelvis there. And we're going back and forth. You'll see here how I am just hovering the heel. That will typically get you a bit more glute. We can talk about that in a different video. So we're just initially, what we can do is we can start with just a hold. So I'll typically start a client here, and I'll have them push down with the foot slightly back to get a bit more demand into the hip extensors via the femur. But the mass, the weight of my head, arms, and trunk will essentially try to pull that pelvis forward even more so. So we'll be getting load into the glutes, into the spinal extensors, and some level of load into the hamstrings, the proximal hamstrings as well. Of course, I can load up my body here with some external weights, some dumbbells, kettlebells into my hand to add more weight. What I can also do here as well is I can of course move from a static hold of the trunk to a dynamic hold to a bigger range, add some load. But then what I can do here, you'll see at the end, I can essentially bring my hands out in front. What that will do is it will lengthen the moment arm, the hip extensor moment arm, by bringing more mass in front of my body. So it's going to increase the hip extensor demand by adding more weight that's trying to pull that pelvis forward. Okay, you'll feel this yourself. If you get into this position and you hinge forward, you flex your shoulders, you'll typically feel a much greater demand on the hip extensors. Just a nice, easy way to do that for clients at home. But essentially what you're seeing here, and the point of the video here, is to show you that we're really just getting a rotation of the pelvis back and forth. So we'll look at the pelvis here a bit more clearly. It's rotating forward, it's rotating back. It's rotating forward, it's rotating back. There is no translation of the pelvis there. So the shin position is still, and the femur position is still more or less fixed. But if you were to look at this in relation to this knee blocked hinge, I like to use something where I have a lot more space in front of me to move, so I can use my hands in front. So I have a bench here with a yoga Pilates block in front, and I want to really lean into that. I want to make sure I can actually lean my body or my knee into that block. I'm pre-positioning my knee over my toes, so I can get a bit more flexion of the hip via the femur at the beginning. And then what I'm doing is, as I'm translating, or as I'm rotating forward now, I can rotate into the leg a bit more. You'll see how I'm getting a little bit more of a posterior translation, but you'll see more so as I begin to rotate the pelvis posteriorly. As I come back up through the range, you'll see how I can get a bit more. Well, you'll see me essentially move through a partial range here first, and then I can begin to move through a bigger range of motion. You'll see that at the end here. So you'll see here I'm moving through, you'll see more forward translation. Again, translation is different to the rotation. Okay, so I'll show you that a couple of times. So like I said, I'll typically hold statically, keeping the knee contact, keeping the push into the leaning into the block here, trying to push my pelvis back behind me, trying to get that demand into the hip extensors. We'll feel some spinal extensors as well. That's completely fine. You can tweak that if, for example, the client's feeling more spinal extensors. But you'll see here that we're going through a partial range at the start. Partial range here, you'll see a little bit of forward translation, backward translation, forward translation, backward translation, which we can't get on the door frame. And then as we go through a bigger range of motion here, So you'll see the pelvis come further through forward translation. And then as we go back, we're getting more of a backward translation. So essentially what happens is the forward translation couples with a posterior rotation, and the backward translation couples with a forward rotation. So forward translation couples with a backward rotation of the pelvis, a posterior translation, and a backward translation coupled with a forward rotation of the pelvis in this scenario here. Again, you'll see how we still have a kind of a longer stance between rear foot and front foot here. But those are your main differences here. Now, the reason we are kind of stabilizing segments, if you like, is to reduce the overall coordinated demand of the task. That allows us to be more intentional with where that load is going. So if I'm setting an intention for the clients to feel that load go into the hip extensors, then I want to ensure they're getting load into the hip extensors. A way we can do that initially is by reducing coordinated demand and adding some reference points there, or points of fixation, where we can keep that demand on the hip extensors. We can be more certain that the hip extensors are experiencing that demand. Because if we were to do this in open space, for example, which is where we may progress to, there's an added coordinated demand, there's an added stability and balance demand, which can sometimes make things harder, but not for the reason we want it to be hard, which would be, I want the glutes to start talking to me, I want the glutes maybe to eventually start screaming at me, I want them to really engage and experience that load. A great way to do that is by using these blocked hinging strategies. And one kind of added difference here, of course, as well, is that with this more rotation, I'm only going to be able to get a certain amount of shortening. It's more of a length biased hinge, if you like, because I'm not really bringing that pelvis through more translation. So when I bring that pelvis through more if I freeze it there, for example, you'll see how I'm getting more of a shortening of that glute there. And as I shift it back, I'm getting more length. So you go through a bigger excursion of lengthening and shortening with this knee blocked hinge, with the door frame pelvis blocked hinge. You maintain the bias of length at the hip extensors. Okay, but again, two great variations. I will generally use the pelvis blocked hinge first, and then move on to the knee blocked hinge. But I think they're great ways to really increase the demand. Like, you'll have clients that are doing kind of more unsupported hinging strategies. They may feel the whole leg working, they may feel like their whole system is working. But when you get them into these positions here, they'll feel like the main thing that is working hard is the hip extensors, or are the hip extensors, the glutes. Okay, so they know that when they stop the activity, they're stopping because the hip extensors can't do any more. If you're pushing to failure, for example, you don't, of course, always want to push to failure, but sometimes in a unsupported position, sometimes other things can push you faster to that failure point, or to that point where you say you can't do any more. It can be the added coordinated demand, the balance demand, stability demand, the skill demands, of course, of it as well. And so it all depends on your intention. But hopefully these hinging variations give you some added strategies that you can use with your clients. And of course, like always, if you have any questions, please let us know below.